An estimated 1/3 of women experience depression or anxiety during pregnancy or in the postpartum period, yet less than 20% seek treatment. Now, these women experience a disproportionate rate of poor birth outcomes, including preterm birth, operative deliveries and low birth weight. This is particularly true for minority women. Working to provide an evidence-based intervention that can improve pregnancy, birth and postnatal outcomes nationally is the Ohio State University College of Nursing. On campus, our reporter learns more about this cutting-edge research that could improve outcomes for a vulnerable population of women and their children.
Inside this lab is the foundation of research, helping to deliver solutions and hope to pregnant women living in stressful circumstances.
Up to 50% of women experience prenatal depression or anxiety, and health disparities are great.
Bernadette Melnick is the Dean of the College of Nursing, University Chief Wellness Officer, and Executive Director of the Helene Fold Health Trust National Institute for Evidence-Based Practice at The Ohio State University, which also houses the Martha S. Pitzer Center for Women, Children, and Youth at the College of Nursing.
Women receive prenatal care, but so often providers do not screen for depression and anxiety. And if we don't screen, we're not going to pick it up.
The Martha S. Pitzer Center, in tandem with the Helene Fold Health Trust National Institute, is translating research into real-world settings to help pregnant women who struggle with perinatal mood and anxiety disorders, with a special emphasis on minority women who tend to have poor health and birth outcomes.
We are targeted to enroll nearly 400 women in this study.
These women are part of a cognitive behavioral skills building healthy lifestyle intervention that is being tested with funding from the National Institute of Minority Health and Health Disparities.
Our goal is to create biologically informed screening tools that can help clinicians really serve their patients the best they can throughout their pregnancy.
Shannon Gillespie and Carmen Gurgesu are nationally recognized for their research on maternal health. Gurgesu's research is outside of the lab and addresses chronic stressors on these women, the environment they're living in, racial discrimination, and more. These factors, when combined with biological risk, can lead to preterm birth.
African American women and the stressors they experience, these chronic, constant, cumulative stressors across their lifespan may actually put them at risk of higher systemic inflammation.
And increased inflammation leads to greater health problems. Gillespie's research then uses a precision health approach to identify women who are at risk for pregnancy complications.
We're really looking at the cellular and molecular level. The real magic really happens when that evidence that we're generating then is kind of picked up on the clinical side. So working with nurses, clinicians across disciplines to understand how that evidence can really apply to clinical care.
Should we go ahead and measure your baby? That'd be good. Perfect. Very good. And so have you been feeling pretty good?
Yeah. You've got to have evidence behind your innovations if they're going to stick in the real world.
And in this clinical setting, at-risk women will learn how to change their thinking by building cognitive behavioral skills. They'll also learn how to better handle physical stressors within their environment.
These are skills that are in large part coping skills, stress reduction skills, that we know through research are very effective in decreasing depression and anxiety.
The research is already extremely encouraging on the other side of labor and delivery, according to those working in the NICU who constantly see the effects of preterm birth stress.
These are lifelong skills that we are teaching these women, which will positively not only impact them, but also their children.
At The Ohio State University, faculty, staff, and students are taught how to dream, discover, and deliver. And as we've seen today with their example of how cutting-edge research translates into real-world settings, it's clear they're leading us all to a healthier tomorrow.